When it comes to the terms medicine, women, and national development, I think we will not miss at least two names in history. One is the Dr. Fedel Mundo. She was a pediatrician who made breakthroughs in immunization, treatment of jaundice, and providing healthcare to poor Filipino families. I think her innovations and ideas revolutionized not just Philippine medicine, but even medicine in the international arena. Another name that I would want to cite and maybe closer to my field is Dr. Mita Pardo de Tavera, who was former Secretary of the Department of Social Welfare and Development. And she founded a non-government organization that pioneered developmental approach to healthcare. And that NGO actually worked towards advocacies in community-based tuberculosis control programs and promotion of primary healthcare or health for all, which is actually the main goal of universal health care. I was lucky to have been given the chance to work on some of her NGO's community based health programs. And in my work in the communities, I saw that community health workers, not just doctors, but also nurses, midwives, social workers, barangay health workers, and volunteers, were mostly women. And I guess they are the women that I wanted to highlight because they may be names that you don't see in print or in the news or in history books. But these are the women who play vital role in safeguarding the health of people, especially in the grassroots. So if you're gonna ask me, where are the women in nation building? I think in medicine they have been in the front lines of promoting community health or health of the people, and as well as public health. I think health is one of the most important aspects in which women encounter risks that are different from those faced by men. And I think those risks could have maybe given us more empathy and sensitivity in terms of addressing the needs of the vulnerable. So I guess what used to be perceived as weaknesses have become the very reasons for our strengths as women, as persons, and as leaders. You see, women in medicine now excel and lead in clinical medical specializations formerly dominated by men. They even lead as administrators of hospitals and healthcare facilities, as deans and department chairs of medical schools, and they hold high positions, whether in professional medical societies, nonprofit organizations, and government agencies. But I guess more than just holding leadership position, women in medicine lead in terms of coordination of care, promotion of the right to health, and protection of the rights of the disadvantaged. In my work at the Ateneo School of Medicine and Public Health, as well as the Philippine Academic Society of Community Medicine, I have encountered women who have taken leadership roles in terms of excellence in clinical medicine, education, research, management, and public health. Maybe what I'm trying to say is that nowadays women in medicine take on leadership roles beyond just medicine. And that's so Magis.